It's often said that talent is equally distributed, but opportunity is not. As we continue our celebration of Black History Month, we introduce you to a physician whose mission is far more than medical.
She wants not just good health for her patients, but equity as well. CBS 2's Dorothy Tucker introduces us to Chicago Medicine's Dr. Monica Peak.
We've been keeping an eye on your A1C. I've wanted to be a doctor for as long as I've known.
For Chicago's Monica Peak, being a doctor is about far more than physical health.
Started you on metformin.
Yes.
Have you been taking it?
I have been taking it.
High five.
Reluctantly, but I've been taking it.
It's also about encouraging patients' mental and emotional well-being and equity.
Because of structural inequities, things like racial residential segregation, policies that happened, decades ago, that has led to things like differential access in the way that communities can navigate healthy living.
Peak says this is especially apparent when it comes to the diabetes epidemic, where much of her work is centered.
Diabetes is one of the chronic diseases that is not just about medical problems, where there aren't as many parks and green spaces, where there's a concentration of fast food restaurants and a lack of access to fresh fruits and vegetables.
Peak has dealt with her share of inequity, growing up in a mostly white neighborhood in Knoxville, Tennessee.
We were one of very few Black families in our neighborhood, and people would frequently mistake my father for the gardener if he was out there doing the lawn, or my mother for the maid of the house.
But it was her parents, the first in their families to go to college, who taught Peak that education was an important tool for freedom for Black people. They also taught her that she could learn and do anything.
Even though I was a girl, there's nothing wrong with me being interested in science. Whatever I dreamed, I could make happen. And so that was the gift that they gave me.
And so it was Vanderbilt University for undergrad and Johns Hopkins for medical school and a master's in public health, and then the decision to go into internal medicine.
I loved internal medicine immediately. It's like being a detective, or like the first one on the scene of a crime. So people come in and they're like, oh, I have these symptoms, and you're the first one who is trying to sort out what exactly is going on. You can have longitudinal relationships over years. I've had patients for decades.
Labs within a month.
Kim Lee May Woodfork Moore is one of those patients. She's been with Peak for more than 20 years.
Dr. Peak was my husband's doctor first. And he was crazy about her.
But last year, Kim Lee Way's husband, Les, died of cancer.
She was actually in the room with us when he transitioned. She's been making sure that I'm taking care of myself. And I am blessed to have her as a doctor. And I feel like she's also family.
What I want to be remembered by is all of the people that I've brought into the world, that I've helped to sort of shape. All of the patients whose life I've helped to make a little easier.
Yay! I had to remember to breathe. I'm like, breathe, Kim, breathe.
Dorothy Tucker, CBS 2 News.
Thank you, Dorothy. Dr. Peak has also done extensive work in equity and breast cancer care, and she says she hopes for more women and people of color to work in the medical field because, quote, we've got to shine our light on all of our flowers, and we want them to grow.